The Ateneo de Manila University Institute of Philippine Culture, or ADMO-IPC, in partnership with the Department of Science and Technology, Philippine Council for Health Research and Development, or DOST-PCHRD, is providing this webinar as a public service, but it is neither a legal interpretation nor a statement of ADMO-IPC or DOST-PCHRD policy. Reference to any specific product or entity does not constitute an endorsement or recommendation by the ADMO-IPC or DOST-PCHRD. The views expressed by speakers, facilitators, and viewers are their own, and their appearance on the program does not imply an endorsement of them or any entity they represent. Views and opinions expressed by ADMO-IPC or DOST-PCHRD employees are those of the employees and do not necessarily reflect the view of ADMO-IPC, DOST-PCHRD, or any of its officials. Philippine Standard Time is now 1:39 p.m. Welcome to another webinar brought to you by the Ugnayang Pang-AghamTao, or UGAT, the Anthropological Association of the Philippines, and the IPC eTuro Weekend Project. This webinar is funded by the Philippine Council for Health Research and Development of the Department of Science and Technology. We are broadcasting live on remote through the facility of the Institute of Philippine Culture, School of Social Sciences of the Ateneo de Manila University. Today's webinar is entitled Mahirap Maging Mahirap, or It's Difficult to Be Poor. How are the poor coping with COVID-19? This webinar is co-organized with UGAT and co-presented with the DOST-PCHRD. Before we begin, here are some house rules for the webinar. First, if you encounter connection problems during the webinar, please click the Reconnect button found at the top of your screen. Second, please use the chat box for your questions and comments related to the webinar. You can post them at any time. However, they will only be read after the presentation and during the discussion portion. And fourth, we value respect and courtesy the most during our webinar sessions. Again, thank you very much for joining us during this webinar. Much has already been said about the health, epidemiological, and economic governance aspects of COVID-19. The particular focus of this webinar brings out what anthropologists can contribute to the understanding of people, their behavior, and values in this pandemic. Our facilitator today is Dr. Mary Racelis, a research scientist at the Ateneo de Manila University's Institute of Philippine Culture, as well as senior professorial lecturer in its Department of Sociology and Anthropology. She is also senior lecturer at the University of the Philippines Diliman's Department of Anthropology. Her publications cover many areas, most prominently urbanization, the urban poor, community organizing, and women's leadership in informal settler communities. Her close interaction with community-based NGOs and people's organizations over many years and her service on several local and international NGO boards has given her the informal title of activist social scientist. So please welcome Dr. Mary Racelis.
Thank you very much, Trixie, for that introduction. This is Mary Racelis. Let me start by reading the message of our Dean, Fernando T. Aldaba, Dr. Aldaba, where he says, "Dear friends, welcome to the webinar series on engaging communities and networks entitled Sustaining the Conversation on COVID-19. How do we cope?" Many people now are quite anxious and fearful because of the increased uncertainty brought about by the rapid spread of COVID-19, not only in the Philippines, but globally. What we need today is to get the facts straight and to share key information with the wider public. In doing so, we have to reach out to experts, which include the affected people in the communities who are suffering the COVID impact, as well as other resource persons who can provide us with much needed advice and important information on the current pandemic. We are pleased to collaborate with UGAT to highlight anthropological insights in addressing the pandemic. So this webinar series focuses on evidence-based discussion platforms on how community, local, national, and regional responses can address the situation. I am proud of, says our Dean, and thankful to the Institute of Philippine Culture for organizing the activity, as well as to UGAT for partnering with us. Special thanks to Dr. Melissa Lau and Dr. Dennis Batangan for their tireless efforts at leading this initiative. Our gratitude also goes to our partner, PCHRD, for making this event possible. So thank you very much. Thank you, Dr. Aldaba. Now we are very privileged to have a message also from our other sponsors, and let me read that to you. To our partners in the Ateneo de Manila University, our invited webinar resource speakers, and the participants to the eToro We Can webinar. Good afternoon. On behalf of the Department of Science and Technology and the Philippine Council for Health Research and Development, we would like to welcome all of you to this webinar, which we are jointly hosting with Ateneo de Manila University, Institute of Philippine Culture, and Ugnayang Pang-AghamTao in response to the COVID-19 pandemic. We thank the Institute of Philippine Culture of the Ateneo de Manila University for the collaboration with DOST PCHRD on techno-governance projects in support of our health system. We would also like to extend our sincerest thanks to Dr. Carinnes Alejandria, Dr. Joshua San Pedro, Dr. Gideon Lasco, and myself, Dr. Mary Racelis, for their invaluable inputs to the webinar today on the topic, Mahirap, Maging Mahirap. How are the poor coping with COVID-19? The use of e-learning and online distance methodology specifically to provide timely and updated information to our frontline health workers has been one of the priorities of the DOST PCHRD. We are glad that our university partners and other government agencies have joined us in optimizing the use of technology solutions toward a more citizen-centric delivery of government services. We hope you will participate in the series that will run until June 2020. We can and will get, that's the name of it, and we can and we will get through the challenges of the COVID-19 pandemic. So thank you very much for the involvement of our involvement with the USTPCHRD. Now we have the beginning of our session, and our first speaker will be Dr. Carinnes Alejandria. So let me call on Dr. Carinnes to start her presentation. Dr. Carinnes.
Thank you, Professor Mary, for the introduction. Hi, I'm Carinnes Alejandria from the University of Santo Tomas, and I've entitled this presentation as Pandemic in the Margins, Situating COVID-19 Responses in the Everyday Lives of Urban Informal Settlers in Manila. My aim is to provide a nuanced account of this pandemic through the narratives of my collaborators in Manila's biggest informal settlement, which actually is also a field site of Professor Racelis. This place is called Baseco Compound. Baseco Compound is in Manila, in the city of Manila. It is about 52 hectares of reclaimed land, and it has about 60,000 people in it. It's a fluid population, so sometimes it's about 70,000, sometimes it's 50,000. It is also an estuarial community, primarily because of this geographic location, which is in between two bodies of water. We have Manila Bay and Pasig River. Now, for this particular presentation, my lecture will be focusing on 4 key parameters implemented or espoused by the government to battle COVID-19. And these are enhanced community quarantine, social distancing, washing of hands, and balanced nutrition. My argument is that despite the efficiency of these recommendations, their applicability is highly challenged by the everyday realities of those who have been marginalized by our system. Let me go to the first one, which is the enhanced community quarantine, which was officially announced on March 16, and it has put the entirety of Luzon under a strict quarantine condition, such that travel is limited and non-essential industries were closed. The meaning of ECQ for most of us include probably having a webinar like this, going online classes, or working from home. But in the outskirts of our society, we have a different story to tell. For example, what is the meaning of community quarantine in Baseco compound? First meaning is that of disrupted informal economy. Majority of the residents of Baseco compound are highly reliant on informal economies, such as peeling of garlic cloves, sari-sari store, construction work, and even scavenging. With the implementation of the quarantine, majority of these workers have lost their jobs, and this also mean that the households who have been highly food insecure are in a higher or in far more intense level of food insecurity. In my previous works and publications on Baseco compound and food insecurity, I've come to understand that food insecurity is much more severe in experience among women and that of older adults. This is primarily because the role of providing, the role of giving way is assigned or sometimes taken on by these groups of people. And so with this quarantine going on, the limited food source that is received by the family through donations or whatever process are mostly given to preferred members of the family, such as children and in some cases men. Now let me go to the second recommendation, which is social and physical distancing. This was a memorandum that was released on March 13, and it requires people to maintain significant distance, again, from each other to avoid catching the disease. Now, this particular policy is, I think, the efficiency of its applicability is quite class-based, primarily because of the fact that in some places like Baseco compound, space is a precious is a value that is not shared in the same way that we do. Most of the time, houses are about just 10 to 20 square meters, and houses are really closely, almost attached to one another. And the space here is used in multiple contexts, as sleeping area, cooking area, living area, and whatnot. And most of the time, there are about 5 to 7 members using this. There are no spaces for isolation in houses in Baseco. So physical distancing within the house and even outside of the house is a big challenge for communities like this. Next is that of the policy on wash your hands. We have seen a lot of this campaigns on this, washing of hands, commercials and whatnot. But is it really that easy to wash hands? In Baseco compound, it's not. Primarily because, number one, there's a lack of potable water source. And because of this, water is very costly in Baseco. And given that a lot of residents lost their jobs, water usage that is very costly is now being delegated only for essential use, such as cooking food or for drinking. There's also the issue of water disruption, allocation disruption by Maynilad. And so most of them cannot even comply to this concept of wash your hands. The community members that I work with there just recently got their faucet before the quarantine. So it's a bit of a good story for them. But how about those who don't have access to it? Lastly, there is the recommendation to have balanced nutrition. And balanced nutrition means that we eat good food. Without a job and with donations coming in, this is becoming an increasingly difficult scenario for most of them. Primarily because apart from their incapacity to purchase food due to the suspended work, majority are reliant on the food packages that are being donated, such as what you're seeing in the photo. And the problem is that there is a repetition of this, like sardines coming from organizations. It's just sardines all the time, mostly. So what did my collaborators did? Some of them have decided to go diving in Manila Bay to collect crabs and shellfishes to augment the type of food that they can serve their family. And for most of you, you might say this is what we call as Filipino resilience. And most of the time we would say that, look at that's a classic example of how we should be responding to this. But the problem is, what I want to do is for us to rethink this concept of resilience. Are they really resilient? Because if you look into the picture here, they're smiling, they look like they're happy, they got crabs for lunch and whatnot. The problem here is that they got it from Manila Bay. And the toxicity of the water in Manila Bay is very high. That being said, in our own daily lives, we would not even dare to go swim in Manila Bay to collect food, and much more to serve it to our family. So are they really resilient? Is this really a story of are they really lucky? Because I've heard that phrase used most of the time. How about communities that are landlocked? For example, places like Bagong Silang, Payatas, Happy Land, those other urban poor informal communities. Where are they going to get their food sources? That being said, I'd like to point out two parts to conclude this lecture. I'd like to highlight the role of anthropology during this pandemic. The first one is that of the value of engaged anthropology. I think at this time, we social scientists, anthropologists are in a very advantageous position to use their knowledge about communities, knowledge about society, to bring it to the public. And with that, to have policies and actions that could actually alleviate the suffering of the communities that they have been working with. On March 21, having learned of the high levels of food insecurity in Baseco from my community partners, I called for a fund drive. And sometime that week, we were able to deliver, through the help of Edlyn Martinez and her father, Edwin Martinez, we were able to deliver food package for 40 families that are very vulnerable to food insecurity. This is also seen in other accounts of anthropologists who are also trying to help their communities. The last point I'd like to raise is that of collaborative scholarship through social media. At this point that we can't do field work, we cannot stop and unlearning about the communities that we're working with. And it's quite fortunate that we have social media and some of our community partners are in social media. For example, one of my collaborators, Weng Bohol, is actively engaged in informing me of what's going on with them, how are they coping with the pandemic, what do they need, and such. And I think this is a way for us to rethink our ways of doing anthropology at this time. So to conclude, some of the points I'd like to raise is that pandemic experiences are nuanced by age, gender, and space. Public health policies must be revisited to include vulnerable populations living in the margins of society. And lastly, anthropology has a key role in providing localized context to public health policies. Thank you. I think Prof. Mary is having some technical difficulties.
Okay. So thank you very much, Dr. Alejandria. So earlier, we weren't able to introduce and give a little background on her. So Maria Carinnes Alejandria is an anthropologist who does research on issues relating to health inequalities in the global South. She is the lead of the social health studies of the University of Santo Tomas, where she is also an assistant professor in the Department of Sociology. She currently serves as the editor-in-chief of the Journal of Social Health, and she has led projects related to health access behaviors and vulnerabilities in urban poor communities. Her recent publications include ethnographic work on food security and disaster resilience among older adults in Baseco, Manila, which was apparent in her presentation earlier. So, since Prof. Mary, I think, having some
I think I'm back on.
there you are. Okay.
Yes, I'm sorry, Corinne, that I missed your introduction. We're having a little problem here, but now I would like to introduce Dr. Joshua San Pedro, who is a, let me go, I'm having some problems with the computer side here. He is our next presenter and a graduate of both anthropology and medicine from the University of the Philippines. He's a co-convener of the Coalition for People's Right to Health and a community physician for the Council for Health and Development, working with community-based health programs across the country. So it's with great pleasure that we're able to present Dr. who is a doctor in both ways, he's an anthropologist as well as a medical doctor. Dr. Joshua, it's you.
Thank you very much, Mary, for the introduction. And I'd like to thank again the Institute for Philippine Culture and UGAT, the Ugnayang Pang-AghamTao, for sponsoring this webinar. So again, I'm Dr. Josh San Pedro from the Council for Health and Development and the Coalition for People's Right to Health, and I will be discussing my talk on going beyond flattening and distancing, the narrative of social solidarity in the real front lines of COVID-19. So flattening the curve is a popular discourse that we're hearing a lot regarding COVID-19 these days, with regards to how we're able to affect the epidemic curve. We hear it a lot on social media, we hear it in common parlance, but it's important to see that the original model for flattening the curve was originally part of a strategy for community level mitigation, part of the United States Center for Disease Control as early as 2007 for influenza. And the interventions regarding this kind of community mitigation are very similar to what we see now in COVID-19, which is basically isolation and treatment, voluntary self-quarantine, suspension of classes and work, and social distancing, which is something that we hear a lot these days, as well as other individual-based approaches such as cough etiquette, hand hygiene, and face masks. So by looking into the perspectives with regards to flattening the curve, we usually see what is really an individualization of responsibility, that we see that the responsibility for one's own health and safety are really put into the hands of the individual, and especially if that individual is able to purchase, it is able to afford these elements such as face masks that we see are overpriced and are hoarded and are sometimes out of stock because it's really subject to market forces because of scarcity as well as the lack of allocation. And we see a lot of meaning making with regards to wearing face masks and how important it really is. Aside from the scientific data we hear about how effective it is or how important it is to wear face masks during this pandemic, we see a lot of meaning that people really ascribe to the importance of the face mask on its own individual level. But we really see that because it's individualized, removing the responsibility from a larger collective, from a larger authority, it's really part and parcel with what we usually hear about neoliberal discourse, where there is an abandonment of the responsibility and the transformation of our patients to clients or purchasers of care. So in line with this, what is usually part of um, common discourse these days is regarding social distancing. So as mentioned by Ma'am Karine earlier, it's really focused on physical distancing. So maintaining that 1 to 2 meter distance between individuals, no mass gatherings, and working from home. So these are usually what we hear about social distancing, but the core of it, especially in the way we implement it, which is the enhanced community quarantine, is the social distancing protocols, which are in the Philippines are implemented through checkpoints and curfews and enforced by our uniformed personnel. But we really see that social distancing and all its caveats are really a privilege that some of our urban poor especially are unable to afford, especially with the houses that are way unable to maintain that 1 to 2 meter distance. So if you have 1 meter distance, it requires ultimately 4 square meters. And having a family of four in one of the most dense cities, and Metro Manila has 13 of the most dense cities in the world. So it's really something that some of our poor cannot afford. But social distancing, the reason why a lot of social scientists disagree with the term of social distancing is because aside from it really just being about physical distancing, it reinforces that social distance. The social distance that has been present in our society because of that class divide, the wealth divide, and even the health access. So it predates our pandemic, but it is furthered because of these social distancing protocols, that we have privilege assumptions in our health policy, that we are able to assume that every individual has that working class level home to do self-quarantine. And we have our aspects of care that are based mostly in hospitals rather than the level of the community. And it further alienates the individuals, especially their suffering, because we trivialize the suffering. We are able to look at the suffering of others as something that we are able to use for punishment. That we see narratives these days of individuals being put or carrying around coffins. We are threatened with death because of what has been going on. And it is reinforced really by this authoritarian narrative that has been increasing these days because of what we see under social distancing. And it reinforces that social distance because of the discourse on the pasaway, the discourse on the individuals who are not following, and because of their poverty, because of their learned helplessness. So it is reinforced by that popular discourse that we have a culture that is, or some individuals that are not accustomed to following the rules, and it really increases that disparity. So what is lacking in these views on social distance and social distancing, it really forgets about social solidarity, which is something that is really important with regards to maintaining this level of care, maintaining this level of participatory part of maintaining a quarantine during a pandemic, which is something that is often neglected in views of social distancing and is absent in looking at social distance. So I use this aspect of social solidarity as this narrative that is present in some of our communities, as mentioned by Karine earlier, in some more landlocked communities, especially in, for example, Bagong Silangan, Quezon City, an urban poor area, and in Novaliches, where there are workers areas or industrial areas in these places. So these are some examples of how community-based health programs, something that we work in, are able to show this aspect of social solidarity. So in doing these aspects, we know that one thing that during a lockdown, something that is essential for people to have that to be able to follow and to be able to live properly during a lockdown, there's a need for food and water, for lost income or economic needs, as well as essential health services that are not accessible because of the increasing pandemic. As well as the UN has mentioned the need for housing and shelter, as well as the need for emphasizing human rights and dignity, which may be lost under that authoritarian narrative. And this is something that is actually being done in some communities that we have community-based health programs, where there is that solidarity for individuals to provide food for those who have not, as well as the provision of basic health services because of our trained community health workers. So at the same time, we also see this active community engagement, something that is not necessarily seen whenever we talk about enhanced community quarantine, that we need that active community engagement where there is participation of the community as opposed to mere enforcement or following the rules or following strict guidelines under pain of law or punishment. And we see that heightened need for social awareness and conscientization, having that responsibility for each other's sake, that we understand what has been going on, not just looking at the individual, but rather the social awareness, and ultimately seeing how things have been going on, and how if there are a lot of lacks or gaps with regards to these services, we demand the action and the accountability that is afforded to us as citizens and as part of that social contract with our government. So this is something that has been happening as well in certain areas, in emphasizing their role as a community and emphasizing the need for engagement or active community engagement when it comes to these social issues that are often unheard on the level of the community. So these two aspects are able to help not just the individual, but also the community to interact with authorities and referral to higher levels of care when it comes to medical needs, because on an individual level, we know how difficult and how alienating it is for them to do that. So the need for social solidarity is able to answer that lack, that we're able to empower the community, because it is much easier for a community and its leaders to be able to have a sort of solid group or a group dynamic when you deal with larger authorities and higher health levels of care. So what we emphasize here is this narrative of social solidarity that is something that must be heeded and it must be highlighted, especially as anthropologists, when we look at how things are occurring, that we need to see the community as actually the front line when it comes to the fight against COVID-19. We usually hear that the frontliners are those in the hospitals, but we know that this illness is first combated in the community because of the assurance for basic needs, and at the same time, when people get sick, the first people who are supposed to see them are not necessarily the hospitals, but those within the community themselves. And having that social solidarity does not necessarily conflict with physical distancing, that it is something that is part and parcel with maintaining this sense of humanity, or as a culture or as a group during an epidemic. And it emphasizes that collective responsibility over the individualism that is prone and may happen to the panic during this time. And it is having that community-based health program, the organizing in these communities, provides an enabling habitus to those individuals to be able to receive better responses from the government and better medical care. So what is something that anthropologists can provide with regards to what has been going on with COVID-19? We need that counter narrative against the popular discourse that is based ultimately on social realities and the ethnographic data we see in our communities, that it's not necessarily true that people are just are not working and are not contributing to society, and they're just waiting for any help from the government, but at the same time are unable to help themselves. But we see that by looking at the communities, by actually seeing the social realities, we're able to expose that social distance, the distance between what we hear from politicians, what we hear from, as opposed to what we hear from their constituents, and the difference of what we hear from health workers, that people are not valuing their health and they're lying about their concerns, as opposed to patients who just want to receive the care that they are unable to receive in the level of their communities. So this is something that anthropologists and those engaged in social sciences can really expose and bring to the fore, that this counter narrative is actually present, and is not that the prevailing narrative is not the only one that is furthering this authoritarian concepts with regards to this pandemic and this outbreak of COVID-19 and its management. So at the end of the day, one thing that we strive to argue is that we have to go beyond that discourse of flattening the curve. One thing that the Coalition for People's Right to Health has advocated is to change that narrative of just flattening the curve, but we actually have to do active roles with regards to government intervention and demand the communities demanding that level of government intervention by providing for that social protection, the free the food, the compensation, and as well as free healthcare that should be accessible to every individual as their right, and something the government should be able to do. What only when you empower the communities to demand these certain rights. At the same time, we raise the bar when it comes to our standards for our government, and at the same time for our healthcare, to increase the aspect, the aspects of care, not just in the level of hospitals, but also on the level of the community, that we're able to address these solutions, because we go beyond that social distancing by looking beyond the social distance, but rather furthering the social solidarity in order to have this improved notion of health on the level of the community, and have a better notion of our rights with regards to health and a quality of life that is better than the status quo. So with that, thank you very much, and looking forward to your questions later. Thank you, ma'am.
Thank you very much, Dr. Joshua, as I call him. Now we are privileged to have our final speaker, and that is Dr. Gideon Lasco, who is a physician, also a medical anthropologist. He's senior lecturer at the University of the Philippines, Diliman, Department of Anthro, and research fellow at the Ateneo de Manila University's Development Studies Program. He has conducted ethnographic and qualitative research in urban and rural poor communities, particularly on drug use and violence, and barriers to healthcare, as well as perceptions on the healthcare system. Some of you have probably read his articles in the Philippine Daily Inquirer, for which he quite often writes. So, Dr. Lasco, you have the floor.
Dr. Lasco, kindly turn on your mic, please.
Okay. Good afternoon, everyone, and I'm really happy to be here with you to join you in this important conversation. Thank you, IPC and UGAT, for organizing this. So I just want to build on what has already been said by Dr. Carinnes and Dr. Josh about how the poor are disproportionately affected by the pandemic that is upon us. As opening premises, I want to assert the multiplicity of the pandemic. It's not just one thing that people experience homogeneously, but it's actually different experiences all coming together depending on where you are, depending on demographics and temporality. I also want to highlight the fact that the pandemic is a syndemic, as medical anthropologists have pointed. We cannot view it in isolation from other health concerns and from its political context. Now, we all know that the pandemic disproportionately affects the poor, but what I want to offer is a framework for us to further dissect exactly how this kind of inequality unfolds among our poor and other vulnerable groups. So, anticipating future pandemics, previous scholars have already pointed out that, in fact, there are different disparities, including disparities of exposure, susceptibility, and treatment. So let me discuss each of these in the coming slides. First of all, disparities in exposure. Carinnes and Josh have already pointed out how social distancing is impossible. But it's not just the poor that are affected by disparities of exposure. We can also see this among people deprived of liberty. I'm referring to people in jails and prisons. Already, we're beginning to see cases rising among them. So they also are affected by these disparities of exposure, and healthcare workers as well. It's already been pointed out even before that this is a time bomb waiting to happen. COVID affecting our jails. The legal system has moved a bit quite slowly in implementing policies to protect people, many of them with disproportionate punishments for minor crimes, many of them not even proven to be guilty. Healthcare workers also are exposed much more than the rest of us, and that's because not just because of the physical distance, but also the lack of protection that they have, the personal protective equipment. So aside from disparities in exposure, we're also seeing different susceptibilities among different people. The elderly, for one, those with pre-existing conditions, those who are malnourished, those who are unhealthy, are more likely to be affected, to be infected by the COVID-19. This is a rundown of those who have been identified as more at risk. And even though they are biomedical conditions or age groups, there's also a social dimension here because who actually get to be obese and who get to have poor nutrition, poor quality of life. Ultimately, if you look at the social determinants of health and nutrition, they impact further those vulnerable groups, including the poor, both the urban poor and the rural poor. So, so even Philippine data shows that, in fact, it's the elderly that's affected the most. But which kinds of elderly people are particularly vulnerable? So again, disparities in exposure and susceptibility, and the third being, and before I move on, there's also racial inequality. It's not too much of an issue in the Philippines, but we're also hearing a lot of concerns from indigenous peoples and from different communities being disproportionately affected. We can discuss that more later. In Brazil, we've seen how indigenous peoples are particularly vulnerable. They also lack the immunity, the exposure to common viruses, which makes them even more vulnerable. So aside from disparities in susceptibility and exposure, there's also disparities in healthcare access. We've seen this in the way VIPs get tested preferentially, and healthcare workers have died without being even tested. So granted that you already got exposed and got sick, will you have access to healthcare? And that compounds further the vulnerability of the poor. And it's not just health, but also other services. People who are sick are not able to access care. So these are the three disparities in terms of exposure to the and susceptibility, treatment, healthcare access in getting the virus and being affected by it. But beyond these disparities, I would like to add that we should also be looking at disparities that are in coping with the quarantine. This includes economic disparities and social disparities, just as the ones that have been pointed out by Drs. Carinnes and Josh, and also disparities in access to healthcare and other services. So their right to livelihood, their access to food are affected, and this is an economic disparity, of course. We also see the implementation of rules are disproportionate, whereas people who with private vehicles have more mobility. We've seen people caged, we've seen people punished, even humiliated in terms of from these checkpoints, being made to dance and all other kinds of horrible things. So this is not just the pandemic itself. This is not because of the virus. It's because of misguided policies, and that also disproportionately affects particular populations, and as also disparities to access in treatment, not just for the pandemic, but also other health conditions, non-communicable diseases, even access to internet, utilities, and space, even funeral services have been disrupted. So that is also another dimension in which we see disparities. Beyond the urban poor, these disparities affect particular populations, including migrants and refugees, women and children who face household abuse, political critics. We've seen a clamping down on supposedly fake news. So essentially, the pandemic amplifies pre-existing vulnerabilities that have already been there even before this happened, which raises questions for all of us. So if the pandemic is asymptomatic and it cannot be unhinged from other contexts, then should we be only counting COVID-19 cases and deaths? What is not being counted in this kind of narrative? And can we define success not just in numbers, but in words, in terms of people's experiences, their suffering, their predicaments, given what's going on in our country? The point that I want to make by mentioning all of this is that we cannot COVIDize people's lives by assuming that the virus is their paramount concern. For people in Baseco and in many other communities, they need to eat every day. They need to fend for their families. They're afraid of violence and other threats that have already been there all along. Our focus should be on people, not the virus. Our focus should be on protecting people and not just controlling this virus and measuring it based on these statistics. So the call to action here is to really affirm the social determinants of health and demand structural change. And meanwhile, raise capacity. As Josh said, we need to go beyond flattening the curve. We need to identify and protect vulnerable groups, implement targeted policies. Commendably, some LGUs have already moved towards anti-healthcare worker discrimination, and also compassionate implementation of anti-pandemic measures. And as for social scientists, we really need to assert the endemicity of this pandemic. We need to keep reminding people of the different contexts where it's embedded. And we can use our tools, we can use our frameworks. UGAT has an ongoing project to document your own experiences and those of others. So this is a very important project, not just for today, but for tomorrow. And we also need to rethink our methods. As what Carinnes said, we need to make the most of virtual technologies and start looking not just as field sites, but as field events that are unfolding before us. However, and to conclude my discussion, we cannot simply focus on COVID and abandon our critical gaze in other forms of suffering, because they remain and we should still be engaged with all of these other issues. So thank you, and I look forward to the discussion.
Very much. Let me get this back on. Dr. Gideon Lasco. Now we have maybe 10 or 15 minutes for a discussion among the panel themselves to maybe make additional points. And after that, we will go to the large number of participants. Actually, I think something like almost 2,000 people registered for this. So we're really very pleased to have you also on board. Let me ask you the first question, because anthropologists seem to have a special concern about this. One question is, how do people in urban poor communities visualize and explain the coronaviruses? What are their notions of risk, contagion, or resistencia, immunity? You know, what is their indigenous knowledge, understanding of the COVID problem as a health issue? Can I ask any one of you who'd like to start? I guess, Carinnes, you look like you're ready.
Right. So I've read some of the chats actually, and I think this question that you're posing, Prof. Racelis, is same with that. How are they envisioning this pandemic, and how are they responding to this? In Baseco, despite the fact that space is an issue, they understand that this could affect them. They have a neighbor that got positive for COVID. And so what they try is that they build their own masks, and they try to do physical distancing to some extent, like in the picture that I've shared a while ago, where they are gathering shellfishes. They were apart from each other because they said that's their version of social or physical distancing.
Fine. How about, yes, Gideon Lasco, and then I'll ask Josh.
Yeah, so what we're seeing is that I'm hearing that in some communities, people are minimizing the risk. They feel that, well, we have tuberculosis, we have other conditions already affecting us. So this is just an addition to all the threats that we're already facing. But at the same time, we're also hearing a lot of fear. We've seen barangays, sitios, streets closing down completely out of fear that they will be powerless against this virus. So the notion of hawa definitely are very important to look at what informs these actions. Because so far now, without the benefit of ethnography, without the benefit of, because we're not able to reach all of these populations, but it's very important to understand these notions of risk and resistensya that inform these policies, because they do get translated into barangay level policies, including irrational lockdown, stigma and discrimination among COVID positives and healthcare workers. So we need to engage. Definitely, it is an important question, and I don't have full answer, but it's very vital if we are to address stigma and discrimination.
Okay, Dr. Joshua, would like to make a comment on that?
Yeah, on my part, I think one aspect that has to do with the local notions have a lot to do with what is the level of healthcare they're already receiving in their communities. So in communities that are really not used to having proper health services, those who are not that informed with regards to which health aspect are not a big part of their life because they're not present in the community. It seems that these communities are more common to have that sense of having to create new meanings with regards to COVID-19, as opposed to more where health access is more accessible. Their habitus around how accepted these knowledge of science is like. At the same time, there is some room for some indigenous or folk knowledge, which may or may not contribute properly, but the point is that it's really a function of how well a community is adapted with regard to meeting health concerns as well as disease. If the community is able to come together to meet a proper sense of prevention, then we're able to have that sort of community, folk immunity within the community. But if the community is more reactive, their concept of health is just bringing them to the hospitals because there are no health services available in the community, then they're more going to be risky when they bring them to health authorities. So I think that's one aspect that has to be seen with regards to how health access is present and changes the lives of urban poor communities.
Okay, thank you. I think if somebody might have a microphone on, because I think there's a lot of interference. But anyway, we heard most, I think, what you said, Dr. Josh. Let me ask you, it's sort of connected. Maybe another question is, what about the mental health consequences? It's hard to say, the line, what's mental and what's not mental, or whatever, or physical health. But more or less, what mental health consequences are likely to emerge among the urban poor, and how can these be handled and prevented maybe in the future? Can some of you don't all have to speak on that, but if some of you would just raise your hand, then I could tell who would like to comment on that. Any one of you? Yeah, okay, go ahead, Dr. Lasco.
Yes, we've had discussions with mental professionals, and even though the discourse on the middle class mental, it's easy for us to see how there will be particular mental health concerns. The lack of money, the lack of food are stressors enough, and we cannot emphasize the mental health, the mental toll of these problems, compounded with a sense of fear, lockdown, the uncertainty of what's going to happen. And at the same time, especially now, it's very hot. And we have seen these communities, how the ventilation is so poor, people living together in the small space. In normal life, they have adapted to the situation by actually, in some communities, taking turns in spending time in sleeping even. So some houses are so small that they have to take turns in being there. So this lockdown is really affecting not just the economy of the informal economy, but it's also disrupting the tempo of life and really has a lot of mental health consequences. And I can also, women and children are particularly vulnerable as well. So on top of the boredom, that we cannot assume that the poor do not experience boredom as well. So there's so many issues in terms of mental health.
Yeah, speaking of war, I can't help. Oh, yeah. Well, think about this, and then I'll ask Carinnes to speak. Um, they have been criticized very much because, one community went into cockfighting. They saw women gambling out in the streets like they usually do, immediately on a weekend, or cockfighting on their own small scale, and they were immediately locked down and criticized and punished. Maybe, why do they do that? Because that's another aspect. You talk about day life and trying to find ways of living your life under those circumstances. Maybe you'd like to comment from a cultural context. But first, let me get Carinnes, and then we'll open up that other question. Go ahead, Carinnes.
Regarding mental health issues, my recent conversation with my community partner, she was mentioning about that the fact that 2 points rather. First is that a lot more men are experiencing a lot of anxiety, primarily because the burden of providing for their families as construction workers and such is getting higher for them because of the quarantine, and that they cannot do their work, they can't contribute to the family, and so the burden of providing for the family is now relegated to the women because of their informal networks. So anxiety is high among men, and then for the women, there were several reports that women are experiencing anxiety as well because of several domestic violence occurring in their homes. We have to remember that they are confined in their homes, and these spaces are very small with multi-functions, as I've said earlier. And by confining them in these homes, there will the need to escape a person who is actually hurting you is limited, and so that promotes a different another layer of mental health issues for the urban poor.
Thank you. All right. So, Dr. Just, maybe, this whole issue of why do they do cockfighting? Why do the women do bingo? Why do they even do boxing? Yeah, go ahead.
Yeah, I just want to add with regards to mental health as well as that. I mean, with the lack of social amelioration, with the lack of proper income because they are unable to work because of no work, no pay arrangements, most are really having to decide which to prioritize, if it's really the health needs or is it the food, and they have to look for other sources, which is something that we see in cockfighting, in bingo, those other circumstances where people usually go to whenever they have that sense of lacking basic income. So there's also, because of that difficulty in trying to attain those basic needs, you have that what Arthur Kleinman usually brought about, is that double bind hypothesis that can actually lead to more mental health concerns because they're trapped in two double standards between having to feed your family and having to have enough money when anyone gets sick because of what they usually hear in the news. So there's that difficulty of being put in a bind of which to prioritize, which shouldn't be a choice between those two things. But when you're in the poorest of the poor, you're unable to secure food, and you're unable to have that proper income, you have to choose between these two decisions that can really affect your mental health in the long run.
Thank you. And just as a last to that, some people have observed that they have a sense that the number of suicides is increasing, and it's mainly male. I don't know, anybody have any information? I wonder, will we have information as this comes to a close, and hopefully not so many die, but that of those who die, are the urban poor or rural poor disproportionately higher in number of deaths versus their actual presence in the population? Do we have that information, or can we get that so we can maybe do something about it in future? This is related, maybe that's the last series on issues of policies now. Knowing what you know about community and how societies work, can you give us some sense of where do we go on the policy side? You've all, said something about it already, but why don't you do a round on that? Okay, who would like to start? Gideon, you're the policy person, so usually.
Well, one thing that I want to stress when we talk about these is that we really need to be guided by fine-grained data, really granular data. And this is where the collaboration between social scientists and data scientists should come in. Because, for example, in some countries where they cannot really arrive at exactly how many people are dying of COVID, they have tried to compare the number of people who have died this year as compared to the same period last year to come up with some inferences. So it's very important for us to do this collaboratively. I don't want to jump to conclusions without that data, but all I can say now is that we really need those statistics and we need to be there as social scientists to help interpret them. Of course, definitely there will be a disproportional effect in terms of the sickness. Who knows? Many people might have already died and not being counted simply because they're not being reached by our health services. So we really need to, and for that to happen, we also need to have a lot of testing done to have the full extent of the COVID-19.
Dr. Go ahead, Dr. Josh.
Oh, yeah. I just want to add to what Gideon said that with regards to the numbers of the poor dying, one thing that is problematic with how things are being done now in terms of tracing deaths and contacting those who are the contact tracing that is being done, the forms that we usually have are totally focused on really focused on the medical history, but not on the income aspect. Income inequality does not necessarily come out based on the data that is usually used by the Department of Health, based on the health data under COVID-19. So we don't really have this picture of if the poor are more adversely affected. They a lot of the I've talked with WHO officials, and some would say there's no data that the poor are adversely affected because what has been coming out is that so many patients that have are those to the private hospitals, those who are able to afford better levels of healthcare. But these might actually be biases because communities do not have that same level of health access, and some even die without having being tested. Some were not by proper health care. So there's a lot of kind of not just but actually by looking at the social realities in these communities to really find out how are the health services really translating to the lives of these individuals.
Okay, thank you. Just let me round that off by since very important for all social scientists, of course, the health sector as well. One of the things I noticed from my own investigations during this period is community-based data. And when local organizations, POs particularly, are well organized and women's associations, they know who their members are, and they often keep updated profiles of their members. One of the confusions of this whole delivery of goods to barangays is the lists that different groups have different lists. The barangay maybe has or the social welfare people may have a list that goes back to the census. Others have, their differential lists. So the whole issue of community-based data, also controlled by community level people, is part of this whole connection to empirical evidence from all sectors of society relating to this. Right, I think we're now ready to turn this discussion over to the participants as a whole. I must say, I'm just waiting for questions that are supposed to come on the screen for me to read. Can I get some? Well, let me read one here that's here. Okay. From Alan now it got moved. Alan Bantasan, I think economic disparity among poor families as compared with those who are better situated is different in terms of protecting themselves, especially when, hold on, oh my goodness. especially, where's that? I got lost. When they experience hunger. This is true with some of the communities that we know, whereby some of them take the risk of staying in the streets, although they have a community where they live, to beg or to continue vending in order to earn income for their family. I think that's really a kind of a comment, but later on, our panelists might want to go into that. I'm trying to find out where these questions are supposed to come. All right, Mr. Jessilyn Tadeo, how can we influence change in policies individually and collectively, especially when leaders at all levels do not want to listen? Now, I think that's a very important element. Would you like to comment? Who would like to start? Do the leaders listen? Go ahead. Okay, Josh, you're the community one. Do they listen to your community people?
I think it depends. It really, I think leaders tend to listen more if it's a wider community effort rather than certain individuals. So there's really that need for community organizing to be able to bring out that message with a larger group of the community. And especially since a lot of the politicians only really listen with regards to their constituencies, with regards to maintaining they tend to be able to have a higher sense of organizing within a community to be able to make sure that they're listened to. By having many creative approaches, we see more and more different communities are able to mobilize in very unique approaches by posting posters outside their house, by using social media. So I think there are a lot of a wide, larger.
Okay, thank you. Here's one. While I understand that the focus is here in NCR, I think it would also be good to know how our fellow Filipinos from outside NCR perceive COVID-19 and how it is being handled at present. Part of the disunity right now is visible on social media because of the different levels of understanding towards COVID-19. Is there a way for this issue to be addressed? The discussion is very Manila-centric, Metro Manila, NCR-centric, but so much is going on outside which doesn't get really to the fore, doesn't come to the fore. Who would like to comment on that? Just raise your hand so I can see immediately. Okay, let me get Gideon and then Josh, since you're the two. Yeah, go ahead, Gideon.
Yes,
Gideon?
So that question, yes, it's very important because, and that's the role exactly of anthropologists all over the country. This is not just a Metro Manila thing. It's not even just a Philippine thing, but it's happening all over the world and it's unfolding differently. I'm hearing, for example, from LGU officials in Siargao and that they're worried about food security of the seeds. The farmers are worried about the seeds for the next planting season. So the thick description of the whole pandemic, it's so important, and we cannot speak on their behalf. This has to be a joint effort, a collaborative effort of not just anthropologists, but the people themselves who are experiencing this coming together and really asserting the importance of listening to all, and not just different geographies, but different demographics. Women's voices are so vital. Indigenous voices in Bukidnon, I want to mention because some of them are actually might be attending this webinar. I've invited the Bantay Gubat there, the indigenous communities in Mount Kitanglad, and they even held a ceremony, a tribal ritual to for the pandemic. So and they're facing forest fires now because there's no access to environmental services. So I think it's really important to democratize the discussion and not make it Manila centric at all.
Thank you. Josh?
Just 2 points for two narratives that are outside Metro Manila. We hear one prominent information being shared So in this unique, Citizen Patera in Cebu. Here in Puerto Patera, that the community was noted to be very infected with COVID-19, but eventually the community realized that what was the sense of them coming in to keep testing more individuals, while at the same time they were still going hungry because the food was not enough. There's still some lack of food security. So sometimes the narratives are not necessarily different, especially in larger urban areas. But we have to also see the image in um, outside these areas. But basically, they revolve around, again, the importance of the level of health access and the right to health in these areas. So these areas, they highlight that food over the need for testing. This is not really something that is understood when you are starving, you are not able to get the proper social amelioration in your area. And another narrative that I want to bring in that similar to what Gideon mentioned, in Quezon, we have a community of the Dumagat, and according to the Dumagat, one of their ways to maintain social distancing in a time of mass panic and during this epidemic is to go back to their ancestral lands, to go back into the forests and the mountains. And what has been going on is that they are stopped from doing so at the checkpoints by soldiers and those who are maintaining that level of social distancing. But they're unable to comprehend because, for one thing, there are no health services in their area. They're only visited once every 6 months by a health professional. So when they hear what is this COVID-19, it's not really something they understand. And when those who do explain it are not necessarily medically trained, so the soldiers explain to them that it's something in the wind, and it's something that they have a difficulty comprehending because there are illnesses in their folk knowledge that are spread by the wind, but it's not it doesn't fit necessarily. So they will just try to use their folk remedies, and they really do want to just go back to their ancestral lands and to go back to their safety zone. But because of the lack of information, because of the lack of proper health access, these are the communities that we have to look more into. Similar to what we heard in Brazil. So there are some indigenous communities that will be further, probably even more affected. We know that there were measles outbreaks that came out with the Dumagat in 2018, but these were not related to those other health problems that were going around in Manila during the Dengvaksha issue. But there are still big issues with regards to the lack of health access in these areas that can change the narrative and really affect the health status of these communities.
Yes, and if I might, go more into that, we can expect that when a vaccine is developed, of course, there has to be very large-scale mass vaccines. But we know that the decline of vaccination of the regular health vaccinations has gone down really tremendously because of different kinds of political or beliefs. And well, just as an observation, maybe this is another issue that anthropologists and others, health people definitely have to look into is what's the orientation now to vaccination once there are really good ways of handling that, because we have done very badly in recent years in immunization of children, especially. All right, let me read one here. It's in Filipino, but because I know we have many listeners who are English speaking and from abroad, let me see if I can translate this. According to your studies regarding COVID-19 pandemic, what are some of the most important dimension? What is the most important dimension mula sa inyo, from you in terms of what information or data do you know that should be given to enlighten why people, first of all, continue to be poor, but and how can this be addressed? What can you tell our authorities from an anthropological research or involvement point of view about why do people stay poor? It's a big realize. Carinnes, go.
Hi. So,
Yeah, go ahead.
number one is that, of course, we have to emphasize that the reason why the poor remains to be poor is because of structural forms of violence that are still in place. And so, by structural violence, I'm speaking of how we have incorporated in our own policies how to marginalize several sectors of our society. Our, for example, the reason why Basetta compound remains to be there is the reason why the Kyoto compound is actually still there is because they're not given any access to a sustainable location for their residents. So that being said, the question is that how are they going to cope with this? I think that although anthropologists and social scientists have a great role to play, we also cannot discount the fact that they are capable of helping themselves. And so I've seen in the women's group that I'm working with that despite their resource, despite the gap in their resource, they are doing community work, gathering support from outside, bringing inside to distribute to those who are more vulnerable. So I guess my bottom line point here is that how we have to enable we have to support local communities in and their organizations in addressing their own health. We have to localize our ways of supporting them.
Thank you. And if I can add to that, because I also know Basek quite well, community-based efforts is the reason that they're still there. They have resisted all kinds of pressures to get evicted, to be relocated outside the city, supposedly because it's better housing when they know they cannot survive economically there. And they like the ties that they've had with one another as neighborhoods, communities. So it's really the power of organizing, very much so, of groups there to say, we want to stay here, we value this place. Outsiders look at it as terrible, but actually parts of it have been upgraded, and they upgrade it as they go when they have a sense of security that they can stay there, right, as we know. So what you pointed out, local organizing becomes very important, and that, I guess, is one message that governments have to get. On-site upgrading, or if they have to move for some reason that near site, in other words, that they can reconstitute their communities, because that's how they operate, and they succeeded with very little government support all these years. And yet they flourish, they keep improving, but the social services are pretty miserable because those are what government is supposed to offer. So legitimizing them is important. They actually got a proclamation in Baseco that that's really their community. Now the issue is government has to recognize informal settlers, their own.
I think Prof. Mary got disconnected again, so uh, maybe while hopefully she gets to reconnect, maybe one last question for the panel. So if it's fine, to the whole panel, what concrete policies or programs can you recommend to the IATF that would benefit the urban poor? So maybe same as earlier, maybe you can raise your hand if you have any, if you want to go first. Or Dr. Corinne?
So an important way that we could help out the vulnerable communities at this time is by contextualizing the policies that we have. And that being said, we have to, for example, one is that if we are going to, this is going to be a controversial statement though, if we're going to allow for this continued quarantine, we have to offer means of earning, means of livelihood for communities. For example, in Baseco, the delivery of the delivery of garlic that they peel on a daily basis is very important for households. And if the government could allow the delivery of those raw materials to Baseco compound so that they could still continue their job, that could augment the daily income of these households. So what I'm trying to say is that the ECQ, although very, very important, must be tweaked to accommodate the different narratives, different situations that our local communities are in.
Thank you for that. Anyone who would like to go next? Dr. Gideon?
Yeah, so I think that to recapitulate my point earlier about the policies, they have to be guided by physical distancing. And there are ways to continue life by having that as principle, but also not coming up with misguided policies, curfews, and other measures that actually backfire and affect the poor. So we have to be people-centered in our thinking. And very quickly, I want to stress that there's also some community resources that we can tap. The barangay health workers, for example, are an untapped resource. They can be mobilized to provide health services and be empowered to be more active. So there are community resources there, but we have to be compassionate and sensible with our whatever policies that they will come up with.
And Dr. Josh?
I think to cover everything basically is that there's that lack of being providing services already. What this pandemic has really showed is that there's really that gap, that large social distance between government services and the poor. So one thing that we really have to build on is that to change that status quo, that we should not go back to that level of healthcare that is neglecting the poor, that level of healthcare that only provides for those who can pay. So it really has to really redefine how we look at health, how we look at the rights of individuals. So one thing that we have to do, aside from doing the testing, aside from providing the social amelioration, it's really changing how healthcare is really being done in the Philippines, and how we should make it more culturally appropriate and make it accessible to even the poorest of the poor. So it's really, if they want to continue insisting on social distancing, we really have to break and bridge that social distance. We really have to make things better for those who are alienated by the current system.
Thank you for that. So thank you to all our speakers. So Prof. Mary is still experiencing some technical difficulties. So maybe to close the session, we can have one statement from each of our presenters today, just to maybe summarize and highlight important points that you want to highlight at the end. We were starting to talk about that with policy recommendations, but maybe other highlights that you would like to give our listeners or end the session with. Maybe we can start with Dr. Carinnes.
So for me, I think I'd like to end my contribution here by saying that at this time of pandemic, the most important thing that both academics and people from the government can do is to have a clear discussion with one another so that we could have more culturally relevant and definitely going to be effective implementation of those policies in communities that are either way legitimate or undocumented. That's it.
Thank you. Dr. Josh, maybe your last.
Yeah, so as a physician anthropologist, really we have to look at that structural problems with regards to poverty, those structural violence that is being perpetuated by the system, as Dr. Carinnes mentioned. We have to look at these things, and especially as anthropologists, especially as social scientists, we have to look beyond the discourse. We have to look at the discourse properly and critically to see how does it really affect the poorest, how does it really affect the least in society, and to strip it of the privileges that it fails to recognize. So these policies that perpetuate poverty, these policies that perpetuate a sense of othering and privilege, we really have to strip that down, and hopefully really that the role they have to recognize, and we should really push to be recognized in having that lens that it goes beyond that usual analysis of looking at the poor as pasaway, but rather we empower that the other narratives. We have to look at the other ways of looking at things. That's something that anthropologists make sure, and it is their main responsibility to make it safe for human differences, as Ruth Benedict would say. But we really have to work to be able to flesh out these differences in culture, these differences in analysis that should be looked at in a more holistic way, especially in a more humane government and humane governance.
Thank you for that, Dr. Gideon.
So the pandemic has really exposed so much of our societal failings and it amplified a lot of the inequalities we have in society. But our focus and response should really be on the people and not the virus. And the social sciences have a major role to play in this by foregrounding these experiences, by asserting repeatedly how this pandemic is a syndemic and it cannot be approached without solving all of these structural issues, addressing the social determinants of health, and prioritizing the well-being of those most vulnerable to this virus.
So I'd like to once again thank the three of you for everything that was discussed today, and of course Dr. Racelis for bringing in evidence on people's behaviors and values through the anthropological perspective. And we'd also like to thank you again for your time and taking the time out of your days to spend on the webinar. So we hope that everyone, all of our viewers also learned a lot. So we'd also like to thank our co-organizer UGAT, or the Ugnayang Pang-AghamTao, for this opportunity to collaborate. So just some closing reminders for the webinar. I'll be flashing them on the screen next. Settings. So if you encountered connection problems during the webinar, lost connection, or did not finish the webinar, a replay link will be provided to you via email after this webinar. A replay for the webinar is scheduled on April 26, 2020. So we'd also like to request that the participants respond to the evaluation via this link, bit.ly/KKK-COVID Part 3 eval, and the completion of the evaluation will allow you to receive a certificate of attendance for this webinar. So we would also like to request that you start requesting for the certificate by tomorrow, April 22. Also note that replays do not qualify for the issuance of certificates. So as a final reminder, please double check your email address during the registration. Incorrect email addresses will not receive replay links and other related announcements. So we'd also like to inform everyone of our upcoming webinars. So we have a webinar tomorrow, April 22 from 12 noon to 1:30, entitled Ano ang Impeksyon at Paano Ito Maiiwasan, with speaker Dr. Cecilia Maramba Lazarte, and the discussion will be facilitated by Dr. Marita Concepcion Castro Guevara. And you may register for the webinar at the link there, bit.ly/KKK-COVID Part 2. We also have another webinar next week, next Tuesday, from 12 to 1:30 as well, entitled The COVID-19 and Me, Implications of the Pandemic and the Disease Control Measures to the Health System and Society, Part 2, with speaker Dr. Esperanza Cabral, and the discussion will be facilitated by Dr. Maria Elisa Lau. The registration link can be found here at bit.ly/COVIDandMe6. And lastly, a webinar next Thursday, April 30, 2020, entitled Changing Health Belief Models and Behaviors, with resource speaker Dr. Michael Tan. And the discussion will be facilitated by Dr. Sarina Saloma Akpedonu. And the registration link, it can be found on the screen as well at bit.ly/HBM Part 1. So please note that all of our links are case sensitive, so you have to type all of these announcements can be found at the eTuro mailing list at tiny.cc.eTuro-list. So please we strongly urge everyone to continue to join this mailing list to get all of these announcements. You just have to follow the instructions at the link to subscribe, and You may also email us at the following contact details if for any further questions or concerns. So further ado, that ends today's session. So thank you very much again to all of our speakers and all of our listeners for joining today.
Can I still join or no more?
Yes, of course, ma'am.
Sorry, my internet kept going off. Just let me say thank you to our three wonderful presenters and to all the participants there. We wish we could entertain all your questions because you had some very good ones, but we appreciate that anthropologists out there, non-anthropologists, or others who have so much to contribute, all of us together to understand people, to value people, their dignity and their rights. And that's, I think, very much what anthropology, especially when it gets into the engaged anthropology part, that anthropologists don't only do research to publish articles, but they do research that will work with people to support people's abilities to move ahead in their own worlds and to value those everyday lives as our citizens of the country. So I want to thank everybody, including Trixie, for managing all of this despite the ins and outs of the computers. So thank you, everybody, and I will stop now.
Thank you, ma'am. Thank you, everyone. Have a good day.